Communicable Disease Emergency Manager for Boulder County Public Health.
Thank you, Angela. Hello, everyone. It's so good to see you again. Again, my name is Chris Campbell, the Emergency Manager with Boulder County Public Health. I will be doing an update for community members today on our COVID vaccination efforts. Hello, everyone. It's so good to see you again. Again, my name is Chris Campbell, the Emergency Manager with Boulder County Public Health. I will be doing an update for community members today on our COVID vaccination efforts. Hello, everyone. It's so good to see you again. Again, my name is Chris. Hey, Mike, I'm getting a lot of feedback. There we go. Okay. I know we're having some. We'll ask for everyone's. Everyone's patience. We're having some
Las paciencias estamos
difficulties
pasando
today.
ciertas, experimentando ciertas problemas técnicas hoy día. Un momento.
Everyone's patience. We're having.
Paciencia, por favor.
Let's try.
Okay. Sounding okay to everyone? Again, thanks for all the community members joining. I appreciate your patience. Just wanted to provide an update to you all once again on our vaccination efforts in Boulder County. And the focus today is going to be pretty high level and celebratory. We just wanted to give some information on the successes we're having thus far with our vaccination campaign. We usually do a bit of an update, data update around the general COVID response. We're going to focus on vaccines today, just some high level things that we do know. And we will, at the end, we do encourage community members to go to our Boulder County website to look at the data. We are in a place of continued decreasing cases in Boulder County. Hospitalizations along with deaths continue to decline as well, which is all very positive. And we are in the yellow portion of the dial, the statewide dial. So we wanted to take this moment again to remind community members we need to remain diligent like we have been doing. Continue to wear masks, continue distancing, and really access testing that is available. It's free, it's easily accessible right now, and now is a crucial time to keep these things in mind. And then we'll share that really positive information on vaccines. So let me go ahead and share my screen here with you all. Okay. And I will jump into this. I wanted to provide a big picture view for community members, and many of you may have seen this, but it's to be celebrated. So the numbers in the United States for vaccines, there's been 61 million people in the United States that have seen at least one dose of vaccine, and that's something to celebrate. It's about 18% of the United States population. And if you look at that number of members in the United States, community members in the United States that are older than 65, about 60% of the population there, 32 million people have received at least that first dose of vaccine. And, it's sometimes easy to lose the big picture view. We need to celebrate that and also recognize there's significant work to do. This truly is an unprecedented mass vaccination campaign. And I just want to thank the community. I want to thank all the providers, everyone at public health, everyone in our health systems, clinics that have been helping with this endeavor and effort. It's simply been a tremendous lift. And these numbers show you how far we've gotten in the United States. Additionally, in the state of Colorado, there's been about 1 million people with 1 dose of vaccine, which is a great number to celebrate. So again, just want to remind and focus on some of the positive things we're doing with this vaccination rollout. We wanted to remind community members of where we're at with the statewide vaccination plan. There were some changes last week with the phasing, and this really was based on a good knowledge of vaccine availability and vaccine allocation to the state of Colorado. Just to share with community members, we still are seeing a pretty low amount of vaccine and on a weekly allocation. We did see about 11,000 vaccines allocated to Boulder County last week. That is a bit of an increase. 2,000 of those vaccines were the new Johnson & Johnson vaccine, the 1-dose vaccine that Dr. Bina will talk a little bit about. So those numbers are still pretty low. So for community members that are now in that phase 1B3, it's a large number. As you see, about 60,000 community members that fall in that phase 1B3. These are workers in grocery stores, agricultural workers, community members with 2 or more high-risk conditions. It's still going to take a little while to have a vaccine available to you. So we ask for your patience. We will continue to communicate with you. I'll talk a little bit about, again, our websites that have all our providers on the website, and that will allow you, that'll be a good place for you to continue to look for vaccine and the opportunity to get vaccinated. We also know towards the end of March, we have a very large phase, and this is really based on vaccine anticipation of more and more vaccine being available to the state of Colorado and Boulder County. We're excited to move to that phase, but it is very large. It's about 2.5 million people in the state of Colorado, about 150,000 community members in Boulder County alone. So we'll talk a little bit about what that means as we move towards the end of March and our strategies as a community. Another reason to celebrate. So we've had about 66,000 community members in Boulder County that have had at least one COVID-19 vaccine. That's 1 in 4 adults in Boulder County, which is something to celebrate. And you see, we're very excited that number of community members that have that full course, which is crucial right now, is about 37,000 people, almost 38,000 people in Boulder County. Again, this is not to say that we don't have work to do, and community members, we know in some places are still struggling with barriers to access vaccine. So we're going to continue to work hard to ensure every community member, should they make that good decision, should be able to access vaccine. And just want to mention, we, with our community members 70 plus, that was a big focus early on, and really our providers really stepped up to help vaccinate this group of community members. And we've vaccinated with 1 dose nearly almost 90% of those community members in Boulder County. With that full dose, it's been with that full course, which is exciting. It's about almost 66%. And we are diligently moving through additional community members in the 65 to 69-year-old age ranges. So about 66% of those community members have received 1 dose of vaccine. Again, a good thing to celebrate as a community. And just looking at how the campaign is going across the metro area, we know that almost 3 out of 4 70-plus-year-olds have been vaccinated across the metro area. As you see here, and this is a testament to all the hard work that has been done in Boulder County. We are leading the way in that metro area with our community members that are 70 plus. Again, I will mention here that we will be sharing some additional data for some other groups, some other some other age groups in the following weeks. So we'll be excited to share that with you. That'll also be on our website. So we've really focused on community members 70 plus because we know that group has really been impacted by COVID-19, and we're excited we're making progress with those community members. We will mention again, and I'll talk about how we're working to address some of these disparities. And we know that community members, Hispanic and Latinx community members, have had barriers in accessing vaccine, and we are working very hard. And I'll talk about as a community, as a grassroots effort, how we're approaching that. And just a reminder for community members, the approach we've had and will continue to have with the vaccine administration in the county. We have really worked hard to build a provider network. This is about 33 providers, and it's growing in our community. These are all the hospitals in our community, our federally qualified health centers, our clinics, Clinica and Salud. The pharmacies in the county, Safeway and King Soopers have been incredible partners. CU Boulder, other clinics in the community, Hope Lake Clinic, Boulder Medical Center. Together, we work together very closely to ensure that community members can access vaccine. To answer maybe some questions we've heard from the community on this strategy, those traditional clinics, that structure is really built for community members that have good access to IT, have transportation resources. So we're going to continue to urge community members that have those resources to access vaccine through this traditional way. For example, we know, there's lots of businesses in phase 1B4. We'll have more information on this. We're really encouraging those businesses to share information with their employees and staff about these traditional clinics. They're on our website, the portals to sign up on our website. We're working on ways of improving transparency with those, including potentially vaccine trackers, so that working with those partners, folks have a good picture of where they can go to get vaccinated. And then we know that, again, as you saw by some of the data we shared repeatedly, there's significant barriers for some community members. There's community members with limited mobility, homebound individuals. There's geographic concerns and transportation issues with our community members in the peak-to-peak area. Racial and ethnic minorities, we know have barriers to access. And so we have created a couple of strategies, and these are very much community-driven and grassroots strategies for mobile clinics and community clinics. The mobile clinics are smaller, and they will be moving around a bit. We'll talk a little bit more about where they have started and where they're going. Our community clinics, these are going to be long-term sites, and these sites have been identified. We're pretty excited that they are just about up and running. Those clinics, again, they're larger clinics that'll be anywhere from 3 to 5 days a week. And just to be really clear with the community, these clinics are going to be, again, for community members that truly have those barriers. So we are working with community ambassadors and cultural brokers to really have that grassroots reach out to community members that don't feel comfortable with traditional clinics, and those are who these community members or these clinics are set up for them. So we feel like we made good progress on this. And we have a good system in place and a good direction we're going. So again, the goal with these equity strategies is truly to eliminate vaccination disparities. A key component, and Dr. Bina is going to speak to this just after my presentation about vaccine education. And we want to continue to hold town halls and provide information so that community members can really make that informed choice to get vaccinated. And I will just take a moment here to mention that this truly, it really is going to take the community to get us to the end of this pandemic. We really are seeing positive results from folks getting vaccinated. Jeff has shared in the past that we know that, for example, the impacts to long-term care facilities in the county. We have seen the impacts of the COVID disease in those facilities really drop off. We know that's one of the first places we started vaccinating both staff and residents. So together, we really are excited to work with the community and work as a community, to get us to the end of the pandemic. And I know this is a real busy slide. We've shared this before. I just want to really reiterate with the community how this equity strategy works. So you will hear more and more from us on vaccine education and providing information about the various vaccines, how they work, what the side effects look like, and ultimately what the goals are with the vaccine. And answer any questions community members have. So we have done, we've done tens of these town halls. Sheila Davis, our health equity coordinator, along with Elizabeth Mendoza, our cultural broker. Dr. Bina has done many of these town halls to provide information. We had a great town hall with our early childhood providers, for example. If they had questions about the vaccine, they were able to get a lot of those questions answered and make good informed decisions to get vaccinated. So those you will see more of those town halls, and we do encourage community members to send us messages if they would like to have a town hall. We'll work on that. We're looking to bring on additional partners to help us with the town halls, like Clinica, like Beacon Clinic with Boulder Community Hospital. So that is very exciting work. And we have worked really hard with a vaccine equity coordinating committee. And this truly is a grassroots and community-driven group of community members. They are tasked with helping us identify vaccination sites, ensuring they're in the right place, and they're informed by where the community feels comfortable accessing vaccine. And so it's been such a great group to work with. They're making good progress. And then the key to really ensuring folks access vaccine is to connect with them even almost on a door-to-door basis. And so we are working with a group including community ambassadors and community influencers. So chambers of commerce, family resource centers like our center, EFA, Sister Carmen. Our goal is to work with these community members and community connectors to ensure that folks have the information they need, to ensure they know that a vaccine clinic is available to them, and they trust that site. So that work continues. And then we are then making sure that vaccine providers there provide the vaccine in a very culturally relevant and an appropriate way. So we made good progress on this. I'll share a little bit of that progress next year. So just mentioned those town halls. I don't want to touch on that too much more. Dr. Bean will talk about this a little bit, but I would remind community members to reach out to us if that is something they're interested in. Just an update on our community clinics. So again, the reminder is these are larger clinics that again are part of our equity strategy. They're going to be long-term and really a place where folks recognize that they can go get vaccinated. So we're working on a Longmont site that's nearly finalized. It's going to be an incredible partnership with Salud Family Health, who's a federally qualified health center in our community. And they're getting a federal allocation of vaccine, and it really is allocated to meet that equity goal. So we're excited about that. It really is coming to fruition. We should see that available to the community in the next couple weeks. As early as next week, mid next week, we also have a partnership between SCL Health, Clinica Family Health, who is also a federally qualified health center in Boulder County and Boulder County Public Health. We will have a site at our Southeast Community Hub in Longmont. I'm sorry, in Lafayette, Southeast Community Hub in Lafayette. And we're very excited about that partnership. So again, another really good opportunity and partnership to work with our priority populations in Boulder County. I know we've had lots of questions from the community about mobile clinics. The way we started those was really, we wanted to pilot those and see how they're going to work. We worked with some great providers, including Bloom Health. We worked with Safeway pharmacies, worked with King Soopers pharmacies. We're working with additional providers. Boulder County Public Health will be a vaccine provider, along with Boulder Community Health for mobile clinics. These are smaller clinics that will move around and really be informed by the community is the best place to have those clinics. Some places we've explored, for example, are with the school districts and schools, with local churches in the community, and sites in the peak-to-peak area as well in Western Boulder County. We did start this strategy out in independent living sites, and these were affordable independent living sites in the county. So these were partnerships with Boulder Housing Partners, with the Longmont Housing Authority, Boulder County Housing Authority. And so we've had 40 clinics and vaccinated over 650 community members in those clinics. So we're very excited about that and learned a lot. And so the next steps with this approach, we're also looking, we know and have connected with homebound individuals in the community. So we'll be reaching out and going out in the community to vaccinate those individuals. We want to ensure that if there's any additional community members that are now becoming eligible in the independent living sites, they have access to vaccine. And then we will be really looking at the next steps with this approach. So again, likely some clinics, potentially at school-based sites, potentially at other really trusted sites as informed by the community. So we're developing that strategy and really a transparent way of looking at where these clinics are located and how we approve those and get vaccine to community members. Okay, so that's my update. I just want to remind the community, we have a couple sites that really do give good information on eligibility and locations where folks can go and access vaccine. For those community members that do not have good or reliable or not comfortable with online access, they are able to call our Boulder County Public Health Call Center. That number is here, and it's also on our also available. So we can certainly get that out to the community. It's 720-776-0822. And again, we really encourage community members to give us a call there. We can work to give you information and potentially work with you to get you signed up with a vaccine provider. So I think I'll end there, and I'd be happy to answer any questions, or I guess we probably best to go ahead and turn it over to Dr. Avina.
Thank you, Chris Campbell. You're always a tough act to follow. Your slides are tremendous. And I just want to give a shout out to you and your team. You have, and Dr. Indira Gujral have done a tremendous job of working with our partners in our community to make vaccines accessible in a timely way. We know in our community that if we had more vaccines, 20,000, 25,000, our team and our community would be able to give them out. So kudos to you and your team. I have two goals that I'd like to accomplish. One is to talk a little bit about the Janssen or Johnson & Johnson vaccine, as it's called. And then I'd also like to talk about the new quarantine guidelines so that everybody can know that we're with all the vaccines going out there, there's success in our future. So let me talk a little bit about the Janssen or Johnson & Johnson vaccine. I realize that's kind of complicated. They're affiliated pharmaceutical companies, but it goes by either term. This vaccine is a viral vector vaccine. What does that mean? That's a very traditional kind of vaccine where we attach a protein, the spike protein, from the coronavirus to this incompetent virus and inject the virus into your arm. This is how we do most of our vaccines out there, called a viral vector vaccine. We've used it in Zika, we've used it in flu, we used it in other HIV and other vaccines, so that this is a very common and easy way of creating a vaccine. Remember, the mRNA vaccines are attached in the spike protein, the same protein from the COVID-19 or coronavirus, to a messenger RNA. In this case, the vector is an adenovirus, a common cold virus, and we inject that virus into your arm, and that stimulates your immune system. You're similar to the Pfizer and Moderna vaccines. So the side effects are essentially the same. You have a sore arm, swelling, you may have fatigue, you may have muscle aches, you may have even a fever. But again, those side effects are very short term. The good news about this vaccine is it's a single dose. And the clinical trials, it had very rigorous clinical trials, similar to the other vaccines. It had to be approved by the FDA for emergency use authorization, and it still needs to be followed for a couple of years. They had over 40,000 people who participated in this clinical trial worldwide. And I think when you start to think about that, that's a very good thing. And it's just been recently approved, and we're starting to get the Johnson or Janssen vaccine, as it's commonly called, Janssen vaccine in Colorado and across the country. And we'll probably see more and more of this vaccine as we go forward. Now, the good news about this is it's highly effective. And most importantly, it's very good at reducing moderate to severe disease, hospitalizations, and death. And actually, that's what we'd like to see. Similar to the Pfizer and Moderna, it's highly effective. And we can't compare the vaccines. It's impossible because they were tested on different populations. And in fact, this Janssen vaccine was tested in South Africa and Brazil. And as for many of you who have been reading the literature, those are where some of the variants that we're concerned about have occurred. So it may be a slightly less effective, but still very effective at preventing moderate to severe disease, hospitalizations, and death. And that really is the take-home message. If you get offered a vaccine, whether or not it's the Janssen vaccine, Moderna, or Pfizer, as Chris alluded to, take that vaccine, because they're all effective at reducing those severe complications. And it looks like, at least the preliminary data from the Janssen vaccine shows that it's also effective at reducing infection. So while we're still waiting for more vaccine to arrive in Colorado, we still are encouraging people to wear facial coverings over their nose and mouth, physical distancing, washing your hands, avoiding social gatherings, because that's still important as we continue to push out vaccines through our very aggressive programs that Chris Campbell has outlined earlier. So I'm going to stop there about talking about the vaccine. It's, again, a single dose over the age of 18. And the good news also is that it requires less refrigeration. So which means that we can probably push it out in some of the clinics that Chris Campbell had talked about earlier. Rural clinics, mountain clinics, some of our smaller clinic sites, because it doesn't require as much refrigeration or tender loving care as the Pfizer and Moderna population. So that would be more of a good vaccine to use. Still highly effective and very safe, because remember, it went through the emergency use authorization. So I'm going to stop there and see if there are questions, and we can come back to that Pfizer vaccine, to the Janssen vaccine. Now I'd like to talk about some good news, and building on what Campbell talked about earlier, is that the Center for Disease Control and the Colorado Department of Public Health and Environment put out new guidelines. If you are vaccinated, which is tremendous, 2 weeks after you've been vaccinated, you can start to have more normal activities. So if you, for my dad as an example, 93-year-old, he can now go outside because I'm vaccinated. I can actually hug my dad now, which I'm very excited about. So that if you have small social gatherings with other people that are vaccinated, you can actually remove your masks and hug people, which I'm very excited about. Not hugging people, but hugging my dad as an example. So if you also have been vaccinated, you have a small social gathering, invite your grandchildren, for example, over. And if it's just one other household and their risk is low, they're not high risk, somebody who is either elderly that hasn't been vaccinated or has multiple medical conditions that might expose them if they have come in contact with the virus, then you can hug your grandchildren. So that's also very exciting. So I think if getting vaccinated is a good thing, because we're going to start reducing, the Center for Disease Control is starting reducing the restrictions on people that are vaccinated. So that's also a good thing. And also, if you've been vaccinated, some businesses were starting to make the decisions around certain businesses that if you've been vaccinated, you don't have to quarantine. Unless you're in a long-term care facility and assisted living, or you've been exposed to the virus. And then we'd want you to watch for symptoms. And then if you develop symptoms, we'd want you to isolate, get tested, those kinds of things that Chris Campbell talked about. So there's good news in sight. Those restrictions are being lifted for people that are fully vaccinated. So that is another reason why you should consider getting vaccinated, because we can reduce those restrictions and go back to more normal, hugging your grandchildren, hugging your dad, or your elderly aunts and uncles. I think this is a very exciting time to be considering this. And as we learn more about the vaccines, I should say, now that we have the Janssen vaccine, and as we get more and more people vaccinated, I think those restrictions will be loosened up even more. So that's very exciting. But we're still, as we talked about earlier with the Janssen vaccine, we're still encouraging people to avoid large, moderate to large social gatherings. If you're out in public, even if you're vaccinated, you should probably still consider using a mask, physical distancing, washing your hands, all the things that we've talked about, until we get more people vaccinated. So I'm going to stop there. Those guidelines, if you want to learn more about those guidelines, you can go to the Colorado Department of Public Health and Environment website or the CDC website. You can also learn more about the Janssen vaccine from those websites as well. So I'm going to stop there. I know there are questions. I know I didn't cover everything that people wanted to hear, but if you can just put your question and answer into the question and answer box, we'll be happy to answer those questions. Angela, I'm going to turn it back over to you.
Thank you, Dr. Urbina. Well, we want to open the meeting up for questions. We will answer as many questions as time permits. Our presenters are approaching these topics from a place of respect. So we want to remind you that we ask you to do that as well. If we believe that this is not the case, we may need to mute a participant if necessary. I do want to remind the instructions for this Q&A. We will be using the Q&A feature at the bottom of your Zoom screens. So please type your questions there. For those that are on the phone, you can dial *9 to raise your hand and we will call you to answer your question. And to unmute, you can use *6. Please, we ask you to keep your questions short, as short as possible. And we will be focusing on questions about vaccine today. But if you have questions that do not get answered, please send an email to healthinfo@bouldercounty.org. And I'm just going to go through some of the questions here. Dr. Urbina, Chris, this might be for you. We have a question that says, recent Bloomberg vaccine data is indicating that average daily vaccination rates in Colorado are below other states' comparable size. Is this an accurate portrayal? And if so, what can be done to accelerate vaccination rates in Colorado?
I can take that one. Thank you. This is a great question. So what I do know, and particularly for Boulder County and the metro area, is we simply don't have the vaccine allocation. Our providers would be able to do significantly more vaccine should that be allocated to both Boulder County and the state of Colorado and in the metro area. Really, to me, that is truly the reason why we might be lagging behind is simply the lack of vaccine and the lack of vaccine allocation. A good example, and again, we've regularly got an allocation anywhere between 6,000 and 8,000 vaccines on a weekly basis, which simply isn't enough. Our capacity with all of our providers across the board, the 33 providers I mentioned, we could do 25,000 vaccines a week, and I'm confident we're even building the system to be even more robust. To me, it's once that supply is here, we're ready. And you saw the strategies we discussed to ensure vaccines are accessible and equitably accessible. So that's my assessment.
Thank you, Chris. Dr. Urbina, I have a question directed for you. It's asking about antibody tests. So it says CDPHE is showing a rise in the percent positivity in the last few weeks. Do you credit that to vaccinations? And do you expect it to increase over time? And is that useful to assess herd immunity in public policy changes?
This is a question from Alec. He often comes on and asks about antibodies. I appreciate that, Alec. It's a great question. Too soon to tell, Alec. Obviously, any vaccine that we get or a natural infection does increase in antibodies in our populations. Hopefully, as we get more people vaccinated, that antibody rate will continue to rise. But as we talked about in previous sessions, I'm not completely confident that antibody tests are the best way to make policy decisions. I think it's better to consider the vaccination rates among the people at risk, because we know those vaccines are highly effective, as well as continuing to do our mitigation strategies of having people wear masks, a physical distancing, which we call transmission control. If we can keep those rates up really high, and we're getting people vaccinated, those are better ways in terms of, and looking at hospitalizations and deaths and cases are all better indicators in my mind about how we monitor and make policy decisions. I hope that's helpful.
Don't go just yet, Dr. Urbina. I have another question for you. And this is a really good question that we get asked quite a lot. It says, is one vaccine preferable to another if you have already recovered from COVID-19?
Thank you for that question. It's a very common question, and I'm happy to answer it as many times as people ask it. It doesn't matter which vaccine you get. They're all effective. And I think in the future, we'll have other vaccines as well. AstraZeneca and Novavax will also be effective vaccines, because we know that these vaccines stimulate your immune response to create antibodies, as well as other immune cells that protect you against the infection. That they're all highly effective at reducing moderate to severe disease, hospitalizations, and deaths, and increasing evidence that they actually prevent asymptomatic infection. But that information, that research is still out there. So if you get offered a vaccine, you should get that vaccine. Now, the link between getting the infection, that's COVID-19, produces a similar immune response, but we know that immune response from the natural infection only lasts for about 90 days. You can get reinfected. So that it's a good idea, if you had COVID-19 in the past, to get a second vaccine. Now, whether or not you choose to get a Moderna and Pfizer vaccine or a Janssen vaccine, it doesn't really matter. Obviously, one is simpler, so it would make sense if you just want to get one vaccine, you'd get the Janssen if you're available, but it doesn't matter. I would encourage people to get whatever vaccine is available to prevent that reinfection rate.
Thank you, Dr. Urbina. Chris, another question for you. This is about school districts and clinics in school districts. So we have a question here saying that St. Brain Valley Schools amended its agenda about an application from Boulder County Public Health on being a vaccine clinic for 4 dates. And they're asking if there are plans with Boulder Valley School District, and if so, are there any details?
Yeah, thank you. A wonderful question. The answer is yes. There's planning in place. We actually have a team visiting some sites with Boulder Valley School District now, just to assess those and see if they would be a good fit for our mobile vaccination clinics. So we don't have any solid dates on those, but again, these are set to meet our equity goals and strategies. The school districts have been tremendous partners and are very receptive to working with us for mobile clinics. These will likely be weekend clinics, and again, really focused on our priority populations in our community. So you should be hearing more on that in the next couple of weeks about that partnership. But we're excited to work with Boulder Valley School District on this.
Chris, can you also tell us what is the next date for the next phase for 1B4? Is that in stone that it's March 21st?
I don't believe that's set in stone for the community members. Again, I think that is reliant. I think there was another question about the expected, vaccine allocation over the next several weeks. I anticipate that remaining pretty flat, maybe at this basically between 8,000 and 11,000 vaccines for the next several weeks until we get into early April. Our understanding is it will likely increase pretty significantly then, although we're still monitoring that. Our goal would be to be able to provide, based on the allocation, we'll probably see, again, around 35,000 vaccines on a weekly basis, anywhere 30, 35, maybe on the top end, 40,000 vaccines. So that's the allocation we're looking at and hearing about. But again, I'll give a good example for community members so they understand. So we had great providers like Boulder Community Health and CU, and they were able to give out some of the first doses of the Johnson & Johnson vaccine. So we were able to vaccinate about 2,000 community members with those vaccines this past week. And then unfortunately, we're not going to have another allocation of that vaccine for another couple weeks. So the supply chain is still pretty inconsistent. The vaccine availability or allocation to us here in Boulder County is really challenging and inconsistent. And it is our hope in moving into April and May that we're going to have a much larger allocation, getting appointments for vaccines, the number of appointments, the number of clinics are going to be much higher. And so it's going to be less frustrating to have access to vaccine.
Thank you, Chris. We are joined today by Kate Haywood, who is Boulder County Attorney's Office from Boulder County Attorney's Office, and she's going to answer one of the questions here regarding last week's event. Kate, we are being asked, what is being done to mitigate the impact of the recent CU riot on Boulder's community spread?
Thank you, Angela. As we have throughout the pandemic, public health is working with our partners at the city, Boulder Police Department, and CU Student Conduct to identify and take appropriate enforcement action. For properties that hosted gatherings in violation of public health orders, public health will send notices of violation to property owners, managers, and to the extent possible, tenants and landlords, putting them on notice that the property is or is at risk of being designated a public nuisance and source of communicable diseases under public health statutory authority, which could result in public health taking legal action against the property owner to abate the nuisance. Since fall 2020, 40 properties have received notices of violations and 7 properties have been designated as public nuisances. As properties that hosted parties are identified through the ongoing investigations, public health will pursue appropriate enforcement action.
Thank you, Kate. We have a few more minutes before we end this session, but we have 2 more questions that maybe we can answer. And either Dr. Rubina or Chris can take this one. We're asked if the Johnson & Johnson vaccine, that 1-dose vaccine, will be prioritized for the harder to reach communities. Is that the plan, Chris?
Yeah, I'll take that one. This is another great question. I appreciate it. The answer, we're still exploring this, and I will say one good example is our at the Boulder County Jail. That is now a vaccine provider, and so people at the jail, those at the jail that are in the statewide phasing plan will now have access to that Johnson & Johnson vaccine. We feel like that's a great system and great use for that vaccine. Yeah, we do believe that harder to reach or community members that have those barriers likely will use the Johnson & Johnson vaccine. It is a 1-dose, one and done, which is wonderful. But we're going to use all vaccines at our disposal and make those available to community members. So we're talking about this quite a bit with our providers that I've mentioned, and you'll hear more for the community as we learn a little more about the vaccine and honestly with the Johnson & Johnson, how much is available to us as a community.
And this question might also be for you. So somebody's asking about those people with 2 or more health risk factors with no documentation form from a medical provider is needed in order to get a vaccine for 1B3. And I believe that this might cover all phases, but they're asking, is this an honor system?
Yeah, another great question. That is correct. So depending on the providers, in essence, a self-attestation. So you're not going to have to provide any kind of documentation. You'll just say, I attest to the fact that I have these underlying health conditions. So it does vary by provider just a bit. I do know that some of our hospital partners and clinic partners are proactively reaching out to patients that they know have these underlying health conditions. So you might, get an email through those providers. And otherwise, with our pharmacy partners, for example, I know you just you do a checkbox and you attest that you do meet the phasing categories, and you'll be able to get vaccinated.
Thank you, Chris. We are nearing the end of our time together, but I wanted to ask for this wrap up if Jeff, you have any closing remarks.
I do. Thank you, Angela. And I'm going to quickly touch on the one question that I see left in there, which is in terms of CU students, we have sent out messages to all students in conjunction with CU to take advantage of free testing. Because the only way, and this is consistent with large events like this, the only way that we're going to find out if people are positive, because we don't know all the people who attended that, and there was more than just students there, that they take advantage of the free testing. CU's offering that testing, including some mobile testing, and we have ample free testing in Boulder County that's available at multiple sites. I did want to just close up by saying that and we have asked, I'm sorry, I didn't answer the last part of that. We have asked students to self-quarantine for 14 days and to monitor symptoms as well. The closing statement I wanted to make is CU, I think, was a good example of this. We know that people have COVID fatigue right now. They want to get out, especially with warm weather. We know that people are frustrated with the disease, just as I am and anybody on this call is. We know that it's impacted lots of people in horrible ways, and we have light at the end of the tunnel. I want to just reinforce that. We need to keep these strategies up for a couple more months. Chris talked about more vaccine coming at the end of the month. We do keep hearing this. We are anticipating April and May will be high vaccine availability months. So we have a couple months left to make sure that we're focusing on these strategies. And if we can do that, we can keep our numbers down. We do expect with university here and with students going back to school after spring break that we'll see some increases in numbers, especially in those age categories. but we are vaccinating at the same time our highest risk population. So please hang with us, keep the strategies in place, make sure you're masking, social distancing, and we don't have that much longer to go to get through this vaccine stage. And so thank you for all those of you who have been following those prevention strategies up to this point. It's the reason why Boulder County Public Health and Boulder County are able to keep this disease down here in our community. That's all I have. Appreciate all of you tuning in, and we will see you in 2 weeks.
Thank you, Jeff. And I want to thank all of you for joining us today and for your patience at the beginning of our community update. I want to let you know that we'll be going bi-weekly. So every 2 weeks in the future. So our next community update is going to be March 24th. And to keep you updated until then, you can go to our webpage, bouldercountycovid19.org, and visit our social media pages. And again, if you have any additional questions, please send them to healthinfo@bouldercounty.org. Thank you all.